Dr. Ian, what other treatments do you do in family dentistry, and why is it important not to DIY on certain things?
Well, look, one of the most popular treatments at the moment is clear aligner orthodontic treatment, or Invisalign is probably the most common, the most widely known brand that's been around for the longest.
And do you use Invisalign?
So I use Invisalign, absolutely. It's the original, and I mean they talk about it being the original and the best. I think they've been do a lot of the research and development, and the others are all playing catch up. But so I use Invisalign. It's it's a quality product. One of the trends these days are like a do-it-yourself type product, which
does that have risks?
Well,
what sort of risks? Is it like operating on yourself for an appendix?
Well, I think some of them you have to take your own mold, your own impression, and I know as a dentist that taking molds of teeth are not something that is always an easy thing to do, let alone trying to do it yourself on yourself. So the success of something like clear aligner therapy is having a very accurate mold of your teeth to start with. So I use a digital scanner to scan the teeth, and so when you get the aligner, it fits perfectly.
Would it be fair to say that you also went to university to study teeth and jaw and physiology and all that sort of thing?
Well, absolutely. So it's not just a cookbook approach. I mean, anything we do can ultimately affect other parts of your body or your mouth or whatever. I mean, we're talking about a physiologic approach in my practice, and so it's not just to do with the teeth. It's to do with the muscles and the jaw and the teeth and the airway, and so I want to be sure that if I'm moving teeth, that that we're not causing any other issues as well. So I think if you're going to do it properly.